All right, welcome everybody. I'm Dawn Ellison. I'm in the core group of Healthcare Reinvention Collaborative. Our other core members that may or may not be on the call today, of course, Denise is here, Denise Wiseman. Keely Gales, I think, is busy packing and moving. Jennifer Beach is here. Paul Behrens is here. And Wael, I'm not sure if he popped in or not. So
Is
those are
traveling
the
today.
other, is he traveling today? Okay, so
Mhm.
those are the other core members. And we are thrilled to have you join us for this thought-provoking explanation of one of the many healthcare paradoxes. Today, our guest, Dr. Stephen Bezruchka, will be addressing why the richest nation on earth isn't the healthiest. As always, we really value your participation and perspectives. And, we're collectively charting a new path forward. So we're going to dive right in. The format of the event today is I will do a brief introduction of our guest. We will have a very interactive discussion of the paradox that I presented. And then, if we have time, we'll open the floor to conversation between all of us on the call. And then, of course, that's the first 60 minutes, and the last 30 minutes will be our network conversations. So let me introduce our guest. Stephen Bezruchka is a physician, researcher, and population health advocate who has dedicated his career to understanding what truly produces health in societies. Originally a mathematics graduate student at Harvard, he shifted to medicine, spent 11 years in Nepal establishing community health projects before working as an emergency physician for over 30 years and earning a master's in public health from Johns Hopkins. He's taught at the University of Washington for over 2 decades, challenging the conventional wisdom that medical care drives population health by demonstrating that the United States ranks poorly in life expectancy compared to other developed countries, despite spending more on healthcare than any other nation. Stephen, the floor is yours.
Thank you very much, Dawn. Yes. So a little bit about me. I used to be a mathematician and I decided I wanted to do something more useful. And I couldn't think of anything more useful than become a doctor and provide medical care to make people healthy. And I did that in a variety of environments. I lived and worked a week's walk from the road in Nepal, setting up a community health project. I set up a remote district hospital in Nepal as a teaching hospital for Nepali doctors. So I spent about a lot of time in Nepal, and I paid for my habit by working as an emergency physician in the United States because I could take a couple of years off and come back and find a job. In medical school, March 31st, 1971, a professor pointed out that in the 1950s, we had some of the best health outcomes in the world, but by the late 1960s, we had slipped. Other countries had improved their health better than we did. It took me another 30 years to recognize that what I was presented with then really was the most important thing I should have learned in medical school. So I have become obsessed with trying to understand why, when we were one of the healthiest countries back in the 1950s, that's no longer true. So I want to challenge you with that idea. And I think the time I'm going to share my screen and we'll move on. I think Denise has created a poll. Back in 30 years ago, I coined a term, Health Olympics. Suppose health were an Olympic event, and the race was how long you lived. Countries compete in Olympic events. So how would our life expectancy rank compared to other countries? We spend half of the world's healthcare bill. I'll talk more about that. How would we do compared to other countries? Because that's what Olympics are. We compete in events compared to other countries.
All right, 19 we are. Here's end poll, and let me share the results.
Okay, so there we are. Now, for 2022, and I've been using the same source, the United Nations Human Development Report, published every year, and Table 1 lists every UN country and its life expectancy. It only has UN countries, so Taiwan, for example, is not there. Hopefully, some of you are surprised to see that by our length of our lives, we're there tied with 44th with Cuba. Remember, we have been strangling Cuba since 1962, and I would suggest, since our health is the same as Cuba, by the way, I like the measure life expectancy as a measure of health. All it requires knowing is your date of birth, your date of death, and computing mortality rates. And I would offer that if you're not alive, you can't be healthy. So this just looks at people alive, and the average length of life in 2022 that would continue if mortality rates didn't change. Now, as soon as you're presented with this, and remember there were three that put us below 41st, you should challenge this and say, well, that can't be right. All the rest of you thought we were much healthier. Don't believe a word I say. If anything is important to you, verify it for yourself. And how can you verify it? Well, you can go to our Central Intelligence Agency, which has a world rankings website. And if you look up life expectancy, you'll find we're considerably lower. We're in the 50s. Similarly for other sources. And why is that? Well, Taiwan, which is not a UN country, and other countries that aren't in the UN list have people there have longer lives than we do. And so I use the UN data as it puts us in the best possible outcome. Now, how do we interrogate this table? There's almost 7 years separating us from the longest lived country. And what does that mean? Is that just a few more years in a nursing home? If that's what that means, then this, our ranking so poorly really is not significant. It's not very meaningful. So what's our leading disease killer? Somebody want to shout it out? The condition?
Heart disease.
Heart disease, right. It'll dispatch about half of us. What's our second leading disease killer?
Cancer.
Okay, good. And our third in 2022, our third leading disease killer.
COVID.
It was in 2021, but in 2022, it was unintentional injuries. So if we eradicated our three leading killers, we would gain about the almost 7 years and be tied with Japan. So we'd have to get rid of the disease entities that will dispatch over 3/4 of us to be as healthy to be as long-lived as Japan. So why are we down at 42nd, 44th, and Japan number 1? How can we explain Japan's much better health than United States? Anybody been to Japan?
Isn't it regarding the homogeneous nature of their population?
A very important point. It's a very homogeneous population, although recently they're allowing immigrants in because they need more workers. How about personal behaviors? Do you know anything about personal behaviors? Surely they must explain this graph. So out of all the countries on this list, which country has the smallest proportion of men smoking cigarettes? Turns out to be Sweden and United States. About 15% of men smoke cigarettes here. Which country on this list has the highest proportion of men smoking cigarettes? Turns out to be Japan and China. About 45% or almost half of the men in Japan smoke cigarettes. And I've been there. I've verified this. I'm not present. If you've been to Japan, you'll notice really weird things like you're not allowed to smoke on the street in crowded cities. You got to smoke inside. If you've ever been to the Narita airport, they have all these smoking chambers where Japanese men are puffing away. So a personal behavior, I don't think any of you out there are smokers, but a personal behavior that you would agree is not so healthy doesn't explain this. And you can similarly take apart diet and exercise. Sure, smokers in Japan have worse health than non-smokers, but it's a paradox. That is, if smoking went down in Japan, they'd be even healthier than we are. Now, notice that all the countries where people have longer lives include all the other rich countries and some not so rich. Qatar, Slovenia, Chile, Thailand, China, and so on. So what's going on that not only are all the other rich countries, people there have longer lives, but some poorer ones as well. This really is a tough thing to try and understand. And so that's what I hope that you will begin to grapple with. So let's go on. So which of these factors matter most for producing health? All right. So only one thought healthcare quality was important. So what I'm doing is presenting a paper from Boston University's School of Public Health, which looked at 8 countries. And I'm just going to present the U.S. ranking. This was an internet survey, a pretty random survey of people. And guess what they ranked most important? Healthcare. Guess what they ranked least important? Politics. Some of you ranked income inequality, which is another. Yeah, here we are. Personal behaviors, economic inequality. Only one of you ranked politics there. So let's go on and explore this and try and understand it better. Our longest lived state in the United States. Anybody know what it is? highest life expectancy? Turns out to be Hawaii. The Department of Health in Hawaii produced this report, Chronic Disease Disparities Report, Social Determinants. So this is the Department of Health in Hawaii. So on the left, you see a graphic that's on page 2. So what does that graphic really look at? So this is really important because they wouldn't have put it right at the beginning. They use a mountainside metaphor to look at what are the root causes producing health and what are the downstream effects. So Makai is to the water. Downstream are all the chronic diseases that if you don't have yet, you will as you age: heart disease, diabetes, cancer, asthma, and so on. So what does Hawaii, the Department of Health, put on the shore? They put risk factors: smoking, obesity, physical inactivity. That's way downstream. So your personal behaviors, the Department of Health in Hawaii doesn't think are that influential in producing health. What's on the other side of the river?
Access to healthcare.
Healthcare.
Yeah.
What's wrong with Hawaii? Puts healthcare way downstream. Let's go further upstream at the waterfall. Well, there you have poverty, geography, pollution, crime, income, wealth, and so on. We now call these the social determinants of health. But let's go higher. What are the root causes? Social and economic conditions. And above that, political context and governance. So there's something about Hawaii that makes them think that political context is the most important determinant of health.
I just posted a chat in the chat. What surprises you most about this mountain graphic? Quick thoughts. We'll see what they have to say. Denise says we're in trouble.
Okay.
Big trouble, says Jacob.
Or maybe Hawaii's wrong. I mean, they're just, they're the place to go for a vacation. What do they know about health? All right. So if we go back to, let me go way back to, let's go back to here. So this is 2022. Back in the 1950s, we were somewhere in the top 5. The numbers were lower, but we were back then one of the longest lived countries in the world. When I went to medical school in 1970, we were 17th. When I went to public health school in 1992, we were 22nd. So each year, each subsequent year, we fall behind. That is, other countries are seeing faster, more significant health improvements than we are. So let's follow this trend. So here back in 1980, this is the United States in the red, and the other rich countries in the gray, and their average in the darker gray. Back in 1980, we were clearly in the race. And what happened to us around 1910? Our life expectancy stopped improving. Matter of fact, it went down a little bit. And then with COVID, it really tanked. Notice the other countries had only a small decline in COVID. 1 in 300 Americans died from COVID. And so we had a huge carnage that wasn't there in the other countries. So what's happening here is our health improvements have stopped. And that's a very worrisome sign. Another way of looking at this is a graph of life expectancy trends from 1995 to 2015 for just these 10 countries from the Organization for Economic Cooperation and Development. So the vertical axis is life expectancy. On the horizontal axis is how much money you spend on healthcare adjusted. So $1 in the United States is the same as $1 in Japan. Notice where we end up in 2015 is a lower life expectancy than where Japan was when it started in 1995. So whatever we're doing with our healthcare dollars, it's not working to produce health. And just to give a sense of how much we're spending, in 2023, we spent almost $5 trillion on healthcare, almost $15,000 per person. And that almost $5 trillion is half of the global expenditures on healthcare. So either we're spending on the wrong thing, or we're not getting good value, or, as the Department of Health in Hawaii suggests, healthcare isn't that big a player. So what's our healthcare metaphor? Well, we healthcare workers, I did this for 35 years, busy mopping up the floor. We can't keep up with the flow. This is our job, right? But what needs to be done?
Turn off the faucet.
Exactly. Whose job is that in this country?
Government.
No. It's no one's job, because this is a huge economy. It pays your salaries. It makes huge profits for the pharmaceutical industry, the hospital industry. Nobody wants to turn off the faucet. But yes, that's what should be done. All right, so what about Japan? Why is Japan the longest lived country in the world? Well, this is just a graph of life expectancy from 1960 to 1984. So back in 1960, Japan had poorer health outcomes than we did, and we improved, but not as rapidly as the other rich countries, and Japan just shot on ahead. I want to offer that we made Japan the longest lived country in the world. First, we destroyed Japan at the end of the Second World War. We firebombed Tokyo, dropped 2 atomic bombs on the country, and then we occupied Japan for 5 years. And the head of the occupation was a U.S. Army 5-star general, Douglas MacArthur, shown here with the Emperor Hirohito. And MacArthur rewrote the Constitution for Japan, and he situated himself across from the imperial palace and did things like Article 9 that abolishes the military. An article in the Constitution had free universal education. Unions had the right in the Constitution to bargain collectively. Article 23 in the Constitution made the government responsible for the health of the people. He broke up the big corporations, the zaibatsu, and he did a very successful land reform program. A few landlords owned the land. He bought the land from the landlords, sold them to the tenants. He legislated a maximum wage, couldn't make more than 47,000 yen. So these were the policies, the political policies put in place by Douglas MacArthur, representing values and ideas from the United States. And to just show what happened, this is life expectancy at age 50 for just 6 countries: United States, Japan, France, Spain, Australia, and Italy. And this is just for women. So back in 1955, U.S. women age 50 had the most years to look forward to, and Japanese women the least. And look what happened. Japanese women raced on up. American women were solidly in the race until about 1980, and they decided, we're just going to step aside. So why? Why did you decide to not seek the health improvements that were there in other countries?
Can we put our next poll up for that? What happened in 1980?
Yes, please.
Would that work?
Okay.
Okay. Was it the empire striking back, Reaganomics, or the Rubik's Cubes that were sold that caused this problem?
What was Reaganomics?
Trickle down? Was that where that phrase came from?
Yeah,
Trickle down, I
Reaganomics
mean?
was, let's give as much as we can to the rich, and they will invest it and create jobs for us, and we'll all be better off. David Stockwell was the principal architect of that. So we suddenly decided to give all the money to the rich. Remember that some of you recognized income inequality wasn't good for us. Okay, so I think Reaganomics and the desire to make the rich richer than they ever dreamed possible was really important. All right, let's take a map of U.S. county life expectancy, and let's look at health in different parts of the country and where you live. So the red is lower life expectancy. The dark blue is higher life expectancy. And you can see in the legend a 20-year gap in life expectancy. Remember, a 7-year gap was eradicating our 3 leading killers. So a 20-year gap is huge. Some of you have lived in dark blue places, and some of you in dark red places. Any thoughts on why life expectancy is better in the blue and worse in the red?
Denise says, I'd be curious to see how much this correlates to other ways of mapping red and blue. Physical inactivity, high-fat food, Jennifer says. Income, Helene Epstein says. Minority density, education.
So the darkest red, I've got my arrow on that. Can you see it?
South
That's
Dakota.
the worst health in the country. Any idea what that represents?
There's
Probably it's a Native American reservation.
That's
it is.
where Pine Ridge Indian Reservation is located. And
Yep,
these
it's
other red
deeply
blotches,
impoverished.
upper Midwest or Indian reservations. So life expectancy among American Indian men in Pine Ridge is actually about 55 years, lower than the average for the county as a whole. So American Indians don't do well. Where's the darkest blue? It turns out to be right here. Can you see that?
Yep.
Colorado.
Colorado, and specifically Summit County in Colorado, where Aspen is, and that's where the rich live.
Mhm.
So If you remember nothing else, remember rich people have better health than poor people, and the richest there do very well. What's this area all about? The Mississippi Valley, poor health. How about this area up here? Appalachia, not so good. The Eastern Seaboard, again, not so good. Look at Hawaii, though. It's all blue there. So any thoughts? Can you situate where you grew up and why the color there is what it is for you?
Jane said lifestyle and diet.
Lifestyle and diet. Okay. How about rich or poor or income inequality?
Mm-hmm.
What about trusting government?
Okay. Those are important factors. All right. Well, remember, most of you joined this because you're involved in healthcare in some way. So let's take a look at healthcare and ask the question: what does healthcare treat? Does it treat cells? Does it treat organs? Does it treat individuals, or does it treat populations? So let's see. I would offer that healthcare treats mostly cells, right? You take aspirin to treat a platelet. You take a statin, you're treating a liver cell. You take Prozac for your corpora cavernosa, H2 blockers for the gastric mucosa cell, and so on. So most of the time, this is what healthcare practitioners do. They dispense drugs that treat cells. And sometimes they treat organs. You know, if you're a cardiologist and you have a heart attack, you can stick a catheter up there and remove the clot. But individuals, you know, how many times I would see a homeless man pushing his shopping cart into the ER and saying he's been weak and dizzy for 6 months. I could spend thousands of dollars on tests to see if I had to admit him. Most of the time, I had to treat him. So we don't treat individuals. We have 1 million homeless children in this country, and treating homeless is not in the drug formulary or the various things that we can do. We should be treating populations, and we should be doing things, you know, affecting political context and governance, and monitor our standing in the health Olympics, getting us moving up rather than down. What do you think happens when doctors go on strike? Suppose we stop working. People laugh, yes. Anything else? Who laughs the most? They don't laugh. It's they cry. Morticians have less work to do. A review study in this social science and medicine paper I highlighted, reductions in mortality may result from these strikes. I'm not suggesting that we improve our health by stopping working as people, as doctors. But I'm suggesting that this further reinforces the idea that healthcare is not that important in producing health. We make a lot of mistakes. And a study published about 9 years ago by Marty McCary here on the right from Johns Hopkins suggested medical care was the third leading cause of death in this country. Marty McCary is now the head of the FDA in the new administration. Healthcare is always a leading cause of death. Well, now that I buried so many of our firm beliefs, what really matters for health? Well, it's the first 1,000 days. As you go from the erection to the resurrection, the first 1,000 days after conception is when roughly half of your health as an adult is programmed. So by the time you're blowing out 2 candles on your second birthday, that's 1,000 days since conception, roughly half of your health as an adult is programmed. So countries that are healthier privilege that early period. How can they do that? Well, there's only 2 countries in the world that don't have a national policy of giving a working woman who's pregnant paid time off after she has her baby. One is, of course, the United States. We say we can't afford that. And the other is Papua New Guinea, half of a big island north of Australia. So, you know, we don't create the conditions that other countries have to support early life. We passed a legislation in 1993 to give 4 months of unpaid leave after a woman has her baby, and after that she can be fired. And when I asked my students how long mothers were with them after they were born, none of them say 4 months. Most people just can't afford that. The other major problem, so early life really matters. The other major problem is inequality. The more inequality in society, the more problems we have. And I'm just going to present 1 or 2 ideas on that. Take all of you have flown in airplanes, and here's a study looking at air rage on airplanes. If you have a first class cabin and you board through the first class cabin, there's more of these behaviors on the right hand side in first class. There's less of those if you board behind the first class cabin as on jumbo jet. There's air rage in coach as well. So we are a very class ridden society. And the first class people don't want to see us. And when we board and sit in coach, we know that we're inferior to those in first class. And you search the web, and I was going to show a little video of the fights that break out, but this is just somebody being challenged for the variety of things that happen. A comprehensive study in the book, The Spirit Level, looked at income inequality on the x-axis, and they took the units off the graph, and on the y-axis is an index of health and social problems. The index, for those of you with some biostatistics, are z-scores, so they're unitless. So they include life expectancy, math and literacy scores, homicides, infant mortality, imprisonment, teenage birth, trust. Remember somebody mentioned trust, obesity, mental illness, social mobility. And there's the United States. We do really bad on those social indices. And of course, we have very high income inequality. And this is really putting the nail in our coffins. So what we do to have such high income inequality? Remember Reaganomics, we decided to give as much as we can to the rich. So here's a study from RAND, published earlier this year, that said from 1975 to 2023, the bottom 90% has given $79 trillion to the top 1%. That's a lot. That's a big chunk of change. How big is that? Well, suppose we took $100 bills. It's our largest currency, freshly minted so they stack really tightly, and stack them on the earth to reach 79 trillion. How far would that stack go? Quarter of the way to the moon. That's how much we, the bottom 90%, I'm there with probably most of you, decided based on Reaganomics to give to the rich. And we've kept doing it with a pace, and the current big bad bill in Congress is going to make this much, much worse. Okay, so not good news. We're racing off the cliff, chasing the almighty dollar. What should we do? We're pushing up daisies far before our time. We got to do something. So what are the kinds of things we can do? Well, we administer a lot of tests in our country, and so standardized tests in grade school, the SAT, the MCAT to get into medical school, LSAT to get into law school, USMLE to get your MD. Suppose there were questions on our health status compared to other parts of the world. If those were on the test, then we'd have to teach to the test, and that would become a part of the curriculum.
Stephen, let's put up our last poll and see how many people the folks on the call think know about our ranking in life expectancy. So, all right.
Well, at least 5 are skeptical, and that's really good because, as I said, don't believe a word I say, because if it's really, if you don't want to die young and you want to live in the United States, go to the CIA website and see how well we're doing, or the World Health Organization, or talk to your neighbors. Those of you who think what I presented is not true, can anybody say why? Put in the chat, or just speak anonymously.
Why they think people might know about this?
No, how many Americans do you think know we rank 44th? Oh, I see. Sorry,
yep,
that's not that you don't believe me. Okay.
Correct.
Oh, here's another action. Suppose the Constitution requires a State of the Union address. Suppose the State of the Union address compared this union with others. And suppose, we'd have to say, well, my fellow Americans, we live shorter lives than people in 43 other countries. But I'm sure that you feel very good about that because you're living in America, and that's much better to live shorter lives here than healthier lives elsewhere. If that was in the address, and it could be put into the Constitution and amend the Constitution that says the State of the Union address must compare ourselves with other unions, we'd be getting somewhere. They don't teach this in public health schools. There's a public health accreditation, CEF, this body, and it only requires comparisons of health within the United States and not with other countries. And myself and other people are trying to get them to modify this. So when we accredit schools of public health, they don't teach this. And I have it on good faith that at my alma mater, Johns Hopkins, they don't talk about this. Suppose media messages included that we're dead first. You know how we have drug ads and they list all the side effects. Suppose the media messages said, and by the way, we die much younger than people in all the other rich countries. That would be one way to get it known. None of the political debates ever discuss U.S. health. So surely that would be important to politicians, but it's totally off anybody's agenda, except Bernie Sanders, I might say. In March, he came out and he pointed out that the United States was not that healthy. Suppose we had billboards advertising this. Suppose we had games on smartphones that talked about this. So billboards. Here's a billboard I photographed north of Seattle. It's pretty good. You think smoking kills? Try working a dead-end job. Worse than smoking. That's implied there. There is a billboard in Boston that I don't have a copy of, but it said, your zip code is more important for your health than your genetic code. And here's a YouTube video that you can watch. Your zip code can carry more weight on your potential health outcomes than your genetic code. So I wrote a book on this, and you can download it for free. It's open source now on my website, stephenbizruchka.com. So go there, download a copy of my book, and you'll get all sorts of scientific information on what I've been saying. P.T. Barnum said, without promotion, something terrible happens. What is that? Nothing.
Publicity.
So we got to get these ideas out there. So I want you to develop some talking points, scripts. I want you to practice your script. And a good way to practice, I have my students do this, is around supper time when you get a marketing call and it's being recorded for quality assurance purposes. Then the people won't hang up and you can practice your script. Americans are dead first. That's a killer fact. Inequality kills. Here's a good one. Do you want health or health care? You can't buy health. It's not for sale. You know, there are so many of these little one-liners that grab people's attention. The one I said earlier, as you go from the erection to the resurrection, the first 1,000 days matter most for our health. Americans have the right to life, but only a short one. The right to liberty is an illusion, as we house a quarter of the world's prisoners. You know, there are many of these that you can make up. And the one from Frederick Douglass, really salient. He was an escaped slave and abolitionist 170 years ago. He said it's easier to build strong children than to repair broken men. But remember, a sixth of our economy repairs broken men and women, and it doesn't do a good job. We need to build strong children. Well, I've ranted on for too long. There's my email. You're welcome to email me for questions, or I can make my slides available so you can use them. I sent them to Don and Denise. So next steps.
I put in the chat, what's one thing you could do in the next 30 days to spread awareness about U.S. health rankings? What's one policy system you interact with you could include this information in? What's one way your organization could address upstream health factors? So I put that in the chat and we'll see if people have any ideas. Stephen gave us a bunch. Sam Cozen says, hashtag buy hospitals. That's what Sam's up to these days in rural areas.
I'm under the impression that one of our biggest problems is American exceptionalism. So I'm actually pretty happy with your slide from Hawaii, because I think we get more traction using Hawaii as an example of how to be than we do from using Slovenia or Cuba or any other country that Americans can't identify on a globe.
That's a good point, Paul. Yes. But Hawaii is not that healthy compared to, a lot of other countries. So,
you remind me immediately of in managing physicians, telling half of them that they're below average has always been very effective because they all think they're above average. And telling America that they could be as healthy as Hawaii could bring up the whole average.
Yeah, we go to the Washington State Public Health Association annual meetings, and we talk about, Washington used to be the second healthiest state, but we've fallen down to 11th. And so we want to see if we can regain our standing. Mm-hmm. But it's going to take, political policies to do that. Mm-hmm. We have the second most aggressive tax policy of all states. By the way, so taxation is very important. And if we take federal, state, and local taxes, those three, and lump them together, who pays the smallest rate of tax on those federal, state, and local taxes?
Yeah. Rich people.
the richest 400 families, the richest 400 families. Now, back in the 1950s and 60s, they paid the most. But just like Reaganomics and our desire to give everything to the rich, we've decided to let them have everything. The rest of us, they pay 23%, the bottom 80% pay about 27%. So it's not fair, I think. I don't want the rest of us to pay more tax than the rich.
One of the things we mentioned in the chat, Stephen, is that we will be making this talk available on YouTube. So that's another way for the word to get out there. And I heard somebody speak up. Go ahead. I'm sorry if I spoke over you.
That's David Perdue. I'm a gastroenterologist. I actually left clinical practice about 6 months ago to work on this problem of patient engagement support. Just the premise that 1 in 4 hospitalizations are really patients not knowing how to manage their own healthcare and not getting the support they need. I'm also a University of Washington alumni. Thank you very much. But Stephen, if you were able to, let's say we redid the tax structure, redistribute wealth, where would be the biggest bang for the buck for those dollars if we were actually going to improve health across the nation? Just giving people more money, or where would we put those dollars?
I put them into policies that support early life. Let's have the same early life policy that Sweden does. In Sweden, you have to take 444 days of paid parental leave, a year and a half almost. And the father has to take a minimum of 13 weeks. And that's at full pay. The rest of the second year is optional at 70% pay. Then in your child's third year, you can put your child in a Swedish government-run daycare center that's free. And what are the requirements to work in a Swedish government-run daycare center? You have to have an advanced degree in play, because what's daycare all about? It's socializing the kid, and you want experts. What are our requirements to work at a daycare center? Work at minimum pay and have no recent history of sexual abuse of children. So that's just, we get what we pay for. And daycare in this country is incredibly expensive. Preschool, free again in Sweden. You went to medical school or that at UW. It's incredibly expensive to become a doctor in this country. If you went to medical school in France or Germany or Sweden, tuition is free and you get a stipend to pay for your daily expenses. So, and salary differentials. In Sweden, a surgeon gets paid about the same as a high school teacher. They value education, and so medical care, people get about the same compensation. So that's one form of early life support, and continue on, free university, a whole host of those things. The government already spends on healthcare per capita more than any other government spends on healthcare that has universal coverage. So we should certainly have universal coverage, free at the point of entry. And we should focus on primary care, because if you ask the question, if we dissect care, is there a part of healthcare that can be shown to be beneficial? I've tried to make the point that the whole picture isn't. But primary care, family docs, primary care internists, pediatricians, the evidence is very clear that they're focusing on them really does improve health.
So I worked for Kaiser Permanente for 18 years. I'm very loyal and I'm very biased. I think a couple of things to add are Kaiser Permanente is 99% focused on prevention versus treatment. That's one thing. And related to that, it is value-based versus fee-for-service. The doctors do not get paid the more they do, the more the money they make. So they do half the number, and I'm exaggerating to make a point. They do half the number of surgeries than Geisinger and Mayo Clinic. And I think we should just add these things to making our health system as good as the rest of the world. And this presentation was fabulous. I'm going to put it on Facebook and LinkedIn. Thank you so much.
So where was the place that you worked? I'm sorry, I didn't get that.
Kaiser Permanente.
Oh, okay. Yeah.
I was in Colorado, but all over the country. I would never get my healthcare anywhere else. Obviously, I'm biased.
I side with you. Thank you.
Thank you, everybody. Thank you, Stephen. We really appreciate the work that you're doing and that you've done for so many years. Your experience in the field in the US and other countries has really enriched our conversation today. And we're just glad that you were here to share it with our community. Thanks, everybody, for coming.
Stephen, thank you so much. This was fantastic.